Jessica and Casey, welcome. I know this is a weighty topic that the public feels passionately about. Casey, starting with you, your team at STAT did a multi-part deep dive into UnitedHealth Group earlier this year. How did what you found impact patients?
Well, we found that patients were being harmed by a lot of the embedded conflict of interests within United's business empire and its operations. So they were finding it harder to access care. They were finding that they were getting denied in circumstances where they felt they really needed care. Competition is being undermined in local healthcare markets around the country because a lot of people don't realize that UnitedHealth Group is both the nation's largest insurance company and its largest provider. So it stands on both sides of countless healthcare transactions. And we don't have a problem with companies in this country being big and doing well, but when their operations and the conflicts embedded within them disadvantage patients, harm them, make profits in ways that feel exploitative to patients, then you see the anger and the outcomes that I think have so many people upset.
Jessica, in the same year as Casey and his team are looking at UnitedHealth Group, you're breaking another major story on the financial struggles of Steward Healthcare and the company's eventual collapse. So were there similarities for what happened with Steward and the impact it had on those patients?
I mean, similarly, you've got a healthcare system that is touching thousands of patients throughout the country. It was in multi-states, over 30,000 employees. And what we had found was that Steward executives had slowly taken money out of the system and that patient care had suffered. We found 15 patients died and thousands more were put at risk. And what we're seeing with Steward, too, is a microcosm of really the pent-up frustration we're seeing now in terms of how the profit motives of these healthcare companies can ultimately disrupt patient care and impact patients' lives.
Yes, you both have so eloquently spoken about frustration, patient care, and money. I want to bring our Globe readers into this conversation and read the letter that one Globe reader sent, which is almost every day a piece of the healthcare system, if you can call it that, is reported to be broken. Maybe it's time to try and look at the systems of care and track more closely where all the money goes. So I ask you two who have been steeped in this investigation of our healthcare system and healthcare entities, where does all the money go? I'll start with you, Jessica.
I mean, I think the way you can think about this is that, similar to what the writer suggests, that every part of the healthcare system is culpable here. Every part of the healthcare system is taking out money. Let's just look at where the most money is spent on an annual basis. So the most recent report from the state shows in 2022, most of the money went to hospitals, $25 billion in 2022, followed by pharmacy, which was about $13 billion. That's massive amounts of money, and people are frustrated at every single stop with the denials, with the prior authorizations. But those are also insurer tools to constrain spending at a time when 40% of the market can't afford healthcare. So really, every part of the industry has to come together to fix things, to make things better, because what we're seeing is a frustration that is experienced across the board and spending that is being taken out at every single turn.
Casey, do you see those same sentiments that Jessica has expressed?
Yeah, my answer to that is the money goes up. It goes up to very large companies that increasingly control huge amounts of healthcare and the transactions that happen every day within it. We have now massive hospital companies. We have a handful of very large insurers, which, by the way, are not insurers. They're insurers, they're providers, they're pharmacy benefit managers, and they're everything in between. And I think the problem that people have and the disempowerment they feel is that they're dealing oftentimes with very, very large entities, and they're getting bills they don't understand. They're being brought into systems that are very big and complex, and when they try to question the decisions that are made or the bills that they get lost in a bureaucracy where they can't get answers. They end up on the phone for hours, and they're dealing with these frustrations while they're dealing with some of the most difficult moments in their lives. And that's the feeling I think a lot of people have right now.
Thank you both for your intelligent and captivating journalism on a topic that is affecting Americans coast to coast. Medical reporter Jessica Bartlett and STAT Chief Investigative Reporter for Data and Technology, Casey Ross, it's been a pleasure.